So, in today's video, we will learn about acute wound management. The initial care of wounds. Wounds that have the following will benefit from cleaning and debridement prior to further wound management. That is, if a wound has devitalized tissue, contamination, or residual foreign material, it might benefit from cleaning and debridement prior to further wound management. Acute traumatic wounds may have irregular and devitalized edges, regular and devitalized edges, or they may contain foreign material within the wound. Whereas surgical wounds that have wound dehiscence or the reopening of the surgical incision may have an infected exudate or GI leakage or necrosis of the muscle or fascia. So these substances impede the healing of the wound. That's why as part of initial care, we have to devitalize the tissue. Devitalized tissue has to be removed, cleaned and debridement has to be done. Now coming to irrigation. Irrigation is most important for cleansing the wound, and irrigation can be done with the warm isotonic normal saline. Irrigation decreases the bacterial load. Irrigation decreases the bacterial load and removes loose material, and it should be part of a routine wound management. So types of irrigation and additives. Usually irrigation is done with a warm isotonic normal saline. However, some research studies argue that there is no significant differences in the rate of infection for tap water versus normal saline. Then the addition of dilute iodine or other antiseptic solutions like chlorhexidine, hydrogen peroxide, H2O2, hydrogen peroxide or sodium hypochlorite or even antibiotics are not necessary. The addition of these antiseptic agents are not necessary. Simple irrigation with the normal saline, warm normal saline will help in the cleaning of the wound. Now there are two types of devices, low pressure versus high pressure irrigation. So low pressure irrigation is usually adequate to remove material from the surface of the wound, and it can be achieved by a standard syringe or bulb syringe. And high pressure irrigators are usually used in the settings like operation theatre. Now, although higher pressure irrigators may lead to relatively minor local tissue damage and increased tissue edema, but there are no specific data available to suggest what should be the cutoff pressure above which the tissue is damaged or impaired rather than improved. So, for highly contaminated, dirty wounds, the benefits of reducing the bacterial load. See, these high pressure irrigators will reduce the bacterial load. So when you weigh the risk and benefits, so it will outweigh the risk of speculative adjacent tissue damage associated with the use of high pressure irrigators. Next, coming to debridement. So excisional debridement is the most appropriate choice for removing any areas of necrotic or infected tissue. So this series of excisional debridement will help in healing of the wound. The sharp excisional debridement can be used as it is shown in the picture. We can use a scalpel, scissors, tissue nipper, or curette to remove the devitalized tissue and accumulated debris or any biofilm that have formed over the wound. So sharp excisional debridement also decreases the bacterial load and decreases the bacterial load and stimulates wound epithelialization, that is forming of new tissue. So it decreases the bacterial load and increases or stimulates the wound epithelialization. Next is identify and treat the infection. So as you know, any disruption of the skin barrier, there is a risk of bacterial infiltration and infection. However, we have to remember that there is normal cutaneous skin flora. So for this reason, a routine wound culture by just a superficial swab of stable wounds, if the stable wound does not have any local signs of infection, that is not advised because it may produce a false positive result. So cultures should generally be taken only when there are local signs of infection. Local signs of infection. So what are the signs of infection? There may be cellulitis, drainage, purulence, or maybe bad odor. So, and the swab should be taken from the base of a wound. Swab should be taken from the base of a wound following excisional debridement and cleansing. So, in this picture, you can see that this picture A is a comminuted fracture of a bone with the road dirt embedded in it following a road traffic accident. And image B is after cleaning it with a high pressure irrigator. So if this image B in this tissue, if there is development of or any signs of local signs of inflammation, then it should be taken for culture. Okay, coming to wound packing. So wounds with large soft tissue defects may have an area of dead space and tunneling, dead space and tunneling, dead space and tunneling between the surface of intact healthy skin and wound base. And the wound measures larger, the wound measures larger at its base. Wound measures larger at its base than is appreciated at the skin surface. So wound packing is considered a standard of care, basic standard of care, and when packing wounds with a significant dead space, the dressing should touch the wound bed. Dressing should touch the wound bed, reduce physiological dead space, and absorb exudate. So, and reduce the potential for infection. So, a traditional gauze dressing is often used to pack wounds, and the gauze is moistened with normal saline and placed into the wound and covered with dry layers of gauze. So, as the moistened gauze dries, it adheres to the devitalized surface tissue, which are then removed when the dressing is changed. So, the dressing changes should be frequent enough that the gauze does not dry out completely, which may be 2 or 3 times daily. So, a disadvantage of gauze dressings, particularly if they dry out completely, is that they might also remove the granulation tissue. They might also remove the granulation tissue, possibly resulting in re-injury. So, an alternative to gauze dressing for managing wounds with significant dead space is negative pressure wound therapy. And in addition to gauze, many of the other materials which are used as topical dressings for wounds, for example, foams, alginates, or hydrogels, they all can be molded into the shape of the wound and can be useful for wound packing. Now coming to wound dressing. So dressing can significantly impact the speed of wound healing and also the strength of the wound. So what are some of the characteristics of ideal dressing? It absorbs, an ideal dressing absorbs excessive fluids, excessive wound fluid while maintaining a moist environment. So it protects the wound from further damage. It protects the wound from further damage and it prevents bacterial invasion. It prevents bacterial invasion and conforms to the wound shape and eliminates dead space. A good dressing will eliminate dead space and it debrides necrotic tissue. A good dressing will debride necrotic tissue and it does not cause damage to the viable tissue. And it achieves hemostasis and minimizes edema through compression. And it will not cause hypersensitivity reaction. It will not cause hypersensitivity or allergic reaction. It will not cause allergic reaction. It eliminates pain and a good dressing is usually inexpensive and is transparent to monitor the wound appearance without disturbing the dressing. But all dressings may not fit all the criteria. It is very hard to find dressings which meet all the criteria mentioned. Now coming to the importance of moisture, the moisture content of a wound must be kept in balance. The area should be moist enough to promote healing, but excess exudate must be absorbed away from the wound to prevent maceration or damage of the healthy tissue. So improved wound healing can also be achieved by exposure of the wound to its own fluid because this wound fluid is rich in platelet derived growth factor. So it's very important to balance the moisture. It should be moist, but it should not be too much to destroy the viable tissue. Then coming to the types of dressings, open gauze dressings, they are available in multiple sizes. Wet to moist gauze dressings are useful for packing large soft tissue defects. Gauze dressings are inexpensive and they often require frequent dressing changes. Next is semi-open. They are fine mesh gauze impregnated with petroleum, paraffin wax or other ointments. So semi-open dressings are relatively cheap and they are easy to apply, but it does not provide good exudate control. Next coming to semi-occlusive. Semi-occlusive film or foam dressings are commonly used in the management of acute wounds. Semi-occlusive films. They are like films, foams, alginates, hydrocolloids, and hydrogels. They are used in the management of acute wounds, and these dressings are sometimes known as synthetic adhesive moisture vapor permeable dressings, and some of the common names are Tegaderm, QT film, blister film, etc. They encourage re-epithelialization, re-epithelialization, re-epithelialization in acute wounds, but they also have limited absorptive capacity. Now coming to adjunct therapies or topical therapy, some of the topical agents like antiseptics and antimicrobial agents may be used to control locally heavy contamination, and some names are alginates, foams, honey, hydrocolloids, hydrogels, and iodine. Next coming to adjunct therapy, negative pressure wound therapy. Negative pressure wound therapy involves the application of subatmospheric pressure. Subatmospheric subatmospheric pressure to a wound covered with a foam dressing. So negative pressure wound therapy reduces edema surrounding the wound, stimulates circulation and provide wound contraction. So these are the advantages of negative pressure wound therapy. It uses subatmospheric pressure to a wound covered with a foam dressing, and it reduces edema surrounding the wound, improves the circulation, and provide wound contraction. And it can also be used for providing programmable intermittent fluid irrigation so that there is adequate moisture at the wound site. Now coming to wound closure. Wound closure can be primary closure, delayed closure, or healing by secondary indentation. So what is primary closure? Primary closure, sometimes also referred to as primary intention, healing by primary intention, refers to the immediate direct opposition. Immediate direct opposition of the wound edges. Immediate direct opposition of the wound edges, so that using sutures or staples. Delayed primary closure, or also known as closure by third intention. So here the wound is purposefully left open for some time, and then the edges are directly opposed with sutures and staples. Then there is healing by secondary intention. So this usually happens for pressure ulcers, venous ulcers, and small burn wounds. So in these cases, the wound is purposefully left open until it is filled with the granulation tissue. It heals by granulation tissue, and eventually there will be epithelialization over time. So at no point are the skin edges brought together by external means. So the process of healing by secondary indentation might be assisted using negative pressure wound therapy. Now coming to skin grafts. Closure using skin grafts. So skin grafts are used to provide coverage for larger or wider wounds without substantial depth. And skin grafts are used to prevent fluid and electrolyte loss. So it prevents fluid and electrolyte loss. Fluid and electrolyte loss, and reduce bacterial burden and infection. Reduce infection. So skin transplanted from one location to another on the same individual is known as autogenous graft or autograft. So skin grafts are classified as either split thickness graft or full thickness graft depending upon the amount of dermis included in the graft. So a partial or split thickness graft contains variable thickness of the dermis. Partial or split thickness graft. It contains variable thickness of the dermis, while a full thickness skin graft contains the entire dermis. Entire dermis. Yes, yeah. So in today's video, we have learnt about the initial care of wound, wound irrigation, debridement, wound dressings, topical agents, negative pressure wound therapy, and about wound closure. So I'm curious to know whether you have any time cared for a wound in a hospital or at home. In that case, what challenges have you faced while managing the acute wounds? Please share your experience in caring for wounds in the comments below, and your story would help each other learn. Thank you. Thank you for watching. Please like and subscribe.